Hi, this is Brandon with Chiro. Today we're going to talk about how to make a diagnosis of cervicogenic vertigo. And there's two pertinent tests that I use in my office on a daily basis to make this diagnosis. These patients often come in with a history of dizziness, but often also have a history of neck pain. And what I know about cervicogenic vertigo is that most of the proprioceptive information, in fact 50%, comes from the top three vertebrae. And when there's an issue with those vertebrae, whether it's a joint restrictions or whether it's muscle hypertonicity or trauma or pain, is that there's a problem with afferentation of information coming from that area of the spine to the brain. And often I tell my patients is that when you are looking straight ahead and go to turn your head 45 degrees to the right, your brain knows that you're trying to turn your head 45 degrees to the right. However, due to hypertonicity in those muscles or joint restrictions, your brain is only, or your body is only able to go 35 degrees to the right. And there's a sensory mismatch in there. And when you have a sensory mismatch, or different parts of your spine are creating different proprioceptive information to the brain, then things get confused. And that's what causes dizziness. So what I can have my patients do is to perform two maneuvers. And those two maneuvers can let me know where this mismatch is happening, where the problem is happening, and the first being the Dix-Hallpike maneuver. Often a patient is going to come in with looking to the left or the right reproduces their dizziness. So what I'm going to have this patient do is quickly look to the left and then fall down, and when she does it, I'm going to catch her head. I'm going to keep her head in ipsilateral rotation and go down to about 30 degrees extension and hold for 15 seconds. I'm also going to be looking at her eyes, looking for any nystagmus and reproduction of chief complaint. Go ahead and sit up for me. The second test that's pertinent would be the head fixed body turn test. And this, you have to be looking at the patient during this test because also you're going to be looking for nystagmus, but you're going to hold their head fixed and then you're going to have them rotate their body about 45 degrees away from you going into that affected side. So I'll have her hold head here and now rotate 45 degrees. I'm looking for any kind of nystagmus or reproduction of symptoms, and then relax. Often you want to be close to the patient during this exam just because sometimes that disequilibrium or dizziness, they can cause them to fall off the chair. These are the two most pertinent tests to make the diagnosis of cervicogenic vertigo. I hope this helps. Check out Chiro if you want to see the treatment aspects of cervicogenic vertigo.